I want us to understand, like, what are some of these roots that are going to tie together everything else that we're going to learn as we go along. And we're going to start with basics. We're going to start with skin. We're going to start with skeletal. We're going to go through, like, what are the structures and really what you're looking for. If you know what is normal, then you can figure out what is abnormal, right? But we need to know what is normal first. So that's what we're going to learn.
Hello, my name is Melissa Behm, and I'm the director for the Academy for Astrological Medicine, founded by Judith Hill. And I am here with Nurse Jessica McConnell, who's going to be teaching our Human Anatomy 101 class in partnership with Judith Hill. So I'm so excited to introduce her. Jessica, I actually met Jessica at NORWAC about 2 years ago. And 3 years ago. And we ended up sitting at the same table. And in the table discussion, I found out that she was one of our students. And I was so honored that we have someone who is a registered nurse who trains other nurses studying with our academy. And so when the opportunity came to explore a human anatomy class, I said, we have so many healthcare practitioners that attend our school. I was like, let's tap one of them. And even before thinking, let's tap one of them, I kept thinking, Jessica, because Jessica is a wealth of knowledge. She's an excellent speaker. She's caring. She's been in healthcare for over 30 years. Like, how is that even possible? You don't look like you're old enough to be in healthcare. She specializes in, I always call it OBGYN. Is
women's health.
Women's health. She specializes in women's health, and she's got so many stories, and we could not be in better hands to be learning from Jessica. I mean, she has also been studying astrology for several years. She studied with Jen Zart, with Judith. She studied with
Rod Susskind, Ben Dykes, Adam Ellenboss.
Yes.
The list goes on. Yes.
The list goes on of people. So she's a lifelong learner, and she's just the best energy. So
I am so excited to blend my career and my passion. It's a really lovely opportunity that I feel like Judith and your team has created. I love the work that she's done, and I love that she has made a place for people who live in both worlds to come together and combine that knowledge. I feel like way back when, astrology and medicine were intimately tied together, and it's come apart over time, and we're marrying it back together again, which does a credit for both professions. So I'm really excited to be part of that.
And I'm excited to have you, especially because you have been in the medical field for all these years, and having been in the medical field around all these skeptics, actually, like knowing the medical protocols, you still believe in the efficacy of medical astrology. And that's really like a really strong testament to the fact that it works, and that it's something that makes sense, and that we can understand through our visual lens. I guess what's fascinating to me is that you have dedicated your life to a life of service, and is always to communities and populations that need it the most. And that's part of the reason why you don't have a huge internet presence. You're not out there talking about yourself. You're out there actually doing the work. When we've talked, you've been on the road to go see a patient. Pretty much every single conversation, you're on the road to go see a patient. And so, talk to me a little bit more about that, and about the reality that you're facing right now as a healthcare practitioner.
I think that medicine is changing rapidly in our country. I think that there is a push towards corporatizing medicine, and it's doing a huge disservice to patients. We're kind of stuck in between insurance companies and healthcare providers, and they're vying for what they need, and patients just get squished in between. So I feel so grateful to be part of a program that can do what I do. And actually, I work with at-risk moms and infants. We do in-home support, and so it's almost like the old days where your doctor came to your house and took care of you there. Like, I get to go into people's homes and do assessments and provide care. And our team also helps to do connection to community resources, getting moms connected to other moms, and creating support in a lot of different ways. So I think that while there is a push towards medicine being less about medicine and more about profit, there's also the other side of the coin where people are stepping in to take care of people in different ways. So
Yeah.
I really, I feel very grateful that it exists and that I got to. If you ask me what my dream job was, I probably have named what I'm doing right now, and it somehow manifests. So, yeah.
So there's definitely a sense of purpose, but it is a system that needs to be improved. So I don't want to bash it completely, because it's really full of like caring, loving people like you who want to be of service and who envision a better world. So I give you kudos for stepping into that and continuing it, and somehow having time for this to teach us about human anatomy.
This is phenomenal. This is like dream come true. So I love to teach. I came out of nursing school, and I had been working in labor and delivery for just a couple of years in the university that I graduated from. The professor, or the head of the women's health department, was at my hospital and asked me to come teach, because I always said yes to students. I loved having students on the floor. And I said, oh, no. And I ended up doing it anyway, of course. And it was phenomenal. I have a Jupiter in the 10th ruling a midheaven in the 9th.
Ooh,
so
nice.
I think that it blends all of that, right? The blood and guts of, I shouldn't say that. We're going to cut that out.
You can say it. I mean, you're in the arena. So like, let's talk about it. We're going to be talking about more than that in our anatomy class. So funny story. I had tapped a family friend who's a surgeon first, before I even considered like going into like our student base, about potentially being available to teach a human anatomy class. And the feedback that I received, he said, why don't you get a nurse? Nurses have to know human anatomy more than the doctors do. He's like, because they're actually administering the medicine to the patients and actually like working with the patients. They have to know it more than the doctors that are prescribing the medicine have to know it. And I thought that was very interesting.
I went back and forth about whether to go to medical school or nursing school when I was younger, and I was putting myself through school. So either was going to be a big commitment, but the kicker for me, or what really sold nursing school, I went around, and I had just gotten health insurance as an adult, and I went around and started interviewing my doctors and my nurses and like asking questions. And the one thing that stuck out to me was that the idea is that doctors treat diseases, nurses treat patients, right? So your doctor is a diagnostician. They are coming up with, it's like solving a puzzle. What is the bug? What is the problem? What is the disease? What's happening? And then they're throwing out a plan of care, but the nurse is implementing that plan of care. So you are exactly right. The nurse is often the one at the bedside, like, who needs to know everything or kind of the hub of the wheel. Like we're there, we're eyes on, and then we report out to everyone else. So that everything kind of can come together correctly.
So you're putting together this curriculum for human anatomy, and we put together the topics that we're going to be discussing in each class, which is on the website. So it's on the class page on the website. But can you tell us a little bit more about like how you're going to be going through it, or some of the information that we're going to learn and what we can expect?
So one thing I know as someone who's done a lot of teaching is that I do a lot of learning as I teach. And putting together the information just for the first class has been like, there's so much, and I'm so excited. I almost don't want to be done because I'm like, oh, talk about this and this and this. So I feel like it is a process that teaches me as I am putting it together as well. There's this back and forth with information that's really lovely. And another thing that keeps coming up are all the correspondences between what we're learning in anatomy and what we're learning in astrology. So I keep getting on these loops and tangents and rabbit holes, chasing down like more fun stuff. So I can tell you there will be a lot of content.
A very structured program. Like I'm going to see your slides after this. You have a very
That is
organized structure for each class. So don't like
yes.
you're just trying to figure out what else you can sneak in there.
Mm. Our first class, I would really like to talk about how this came to be a subject. The history of anatomy is really fascinating, so we're gonna dive into that a little bit, and we're also gonna start with some basics. So, if you understand roots of words, my mom made me take Latin in high school as my second language, so. Because apparently when I was a kid, I said I wanted to be a doctor when I grow up so I could be the boss. Um,
Wow. I love
so it's kept me in good stead. Like I can understand a lot knowing just little pieces of words, right?
Wow.
So I want to start with some of that. I want us to understand like what are some of these roots that are going to tie together everything else that we're going to learn as we go along. And we're going to start with basics. We're going to start with skin, we're going to start with skeletal, we're going to go through like what are the structures and really what you're looking for. If you know what is normal, then you can figure out what is abnormal, right? But we need to know what is normal first. So that's what we're going to learn.
I'm so excited for this. And I know along the way you're going to share some stories. I think particularly people might be interested in some of the stuff you had to go through during COVID. As many nurses had to, it was wild. Like just like I had to give birth during COVID. And what I saw some of the nurses like just working nonstop, chaos, like trying to keep things organized, trying to stop the spreading of infection while they're like bringing life into the world. It was just insane.
It was, yes, everybody else suddenly stayed home and nurses were at work, and not just at work, sometimes at work more and more and more and more because the staffing people just left the healthcare industry in droves. And I remember I was in OBGYN. I worked in the Bay Area in California. And we went from having a staff meeting like once a month to like twice a day, standing in the hallway because things change so rapidly. And in California at that time, there were also the wildfires. So there were hospitals shut down and people would get shipped to us. And I remember triaging people in the ER parking lot. And it was really wild. There was a lot happening all at once. And I think part of being a nurse is a little bit like being a MacGyver. Like you just kind of like learn to put together what works as you go. And
what resources you have available and work with that.
exactly. Yeah.
Wow.
So in a lot of ways, the rest of the world, it felt like was receding, and I had to like come forward, and it was
Wow.
rewarding. It really was. I mean, it was kind of scary.
Yes, I can imagine. Especially because you have young kids.
Yes.
That's crazy.
Yeah.
Yeah.
Yeah. My daughter was in high school. My kids were at home, and so I had my daughter who was in high school at home with my boys, and I'd come home and the entire house would be wrecked. And I'd be like, but so many good things came out of that too. My children learned to do dishes and chores, and the internet was my toy to like turn on and off. If you go for a walk, the internet's on. If you don't, the internet's off. So we were just getting creative.
Yeah, I love that. Oh my gosh, I'm so excited to learn from you. I have people who are non-astrologers who want to take this class. And I said you should absolutely take the class because it's
Absolutely.
plus the added bonus of astrology. So if you don't want to learn the astrology part, that's totally fine, but at least you'll get a crash course in human anatomy. And actually, it's a full course because it's a 7-week course that we're offering. So it's a legit course in human anatomy. And I'm so excited that you're going to be teaching it. Thank you. Thank you so much for teaching for us. We're so honored to have you.
Thank you.